Hello! This video is for family members or future speech-language pathologists, also known as SLPs, that want to know some general information about aphasia. We're here to talk about the terms SLPs use associated with aphasia. While in the hospital, you may hear the doctor, nurse, or speech therapist throw around some confusing jargon regarding your or your family member's newly acquired aphasia. Let's see if we can sort it out together. Before we talk more about terminology, let's first give a brief and general overview of aphasia. Aphasia is a communication disorder marked by difficulties in speaking, listening, reading, and writing. It should be noted that aphasia does not affect intelligence. A person with aphasia is just as brilliant as they were before the damage. They just have difficulties communicating that brilliance. The two areas in the brain associated with language are called Broca's and Wernicke's area. Both of these areas are located in the left hemisphere of the brain. Quite simply, aphasia may occur when there is damage to one or both of these areas of the brain. The type of aphasia will vary based on the exact location of the damage, but we'll talk about that later. It is most common to experience aphasia following a stroke, also known as a cerebrovascular accident or CVA. But aphasia can also be caused by any brain tumors, traumatic brain injury, or any progressive neurological disorders. There are many different types of aphasia, which differ depending on the location of the damage, the severity of the damage, and the symptoms displayed. For more information regarding specific types of aphasias, check out aphasia.org. Since we now have some general background knowledge, let's talk about some of the commonly used terminology associated with aphasia. Terms associated with aphasia, there's fluent versus non-fluent. Fluent aphasia is defined as using 50 or more words per minute. Depending on the severity and type of aphasia, a person's language may be coherent and grammatically correct, yet lacking content and meaning. Non-fluent aphasia, speech is slower and hesitant, and the patient may struggle to get their words out. Even though words may be missing, the message is still being able to be conveyed. Telegraphic speech. This is a slow, labored speech consisting of mostly filler words and few content words. For example, this door, that here, this. Another term you may hear associated with aphasia is paraphasia. There are three types of paraphasias: literal or phonological, neologistic, and semantic or verbal. Literal or phonological paraphasia. This occurs when a person mixes up sounds of words. For example, sog for dog. Neologistic paraphasias are made-up words. For example, catalog. Verbal aphasias are word substitutions. For example, this person may say father for brother or window for door. Then there are circumlocutions. This is a complicated way of expressing something. You might know this term as beating around the bush. This is wordy, without really ever getting to the last term we're going to mention is called perseveration. When a person perseverates, they are stuck on a word, phrase, or sentence and continues to repeat the perseverated phrase. For example, if you're talking to your family member who recently suffered a stroke and asking them what they ate for breakfast, you may notice that they keep bringing up the topic of breakfast long after you mentioned it. There are many terms associated with aphasia, but we hope this gives you a better understanding of the terms that might be overwhelming after a diagnosis of aphasia. Thanks for watching!